Hello, I'm Kevin McEleny. I'm a male fertility specialist from Newcastle. Many of you watching this will have been affected by the coronavirus emergency, which has unfortunately resulted in treatments being cancelled or postponed. This is because we need to weigh up the risks to our patients and the healthcare workers, and also many of us will be redeployed to other areas within the hospitals to deal with the crisis. Hopefully we will get this thing sorted and we'll be back to treating you as soon as we possibly can. So for the rest of this video I'm going to be talking a bit about male fertility, which is something that affects many people. So when a man has a male fertility issue, it's important to try and work out whether it's a mild issue that might mean that they can get their partner pregnant versus a more significant sperm quality issue that might mean that they need fertility treatment to form a family. So in terms of the milder issues, this is generally based on the sperm concentration or the concentration of sperm that are moving well in the sample. If you fall into this category, I think it's important to look at any lifestyle factors that might hopefully give your sperm quality a bit of a boost to enable you to conserve naturally without help. So we're talking here about things like people who smoke cigarettes, use recreational drugs, people who are overweight, or perhaps drink alcohol excessively. Modifying these lifestyle factors might make an improvement. It's important to maintain a healthy diet, lots of fruit and veg. A diet that's good for your general health is also a diet that's good for your fertility. Anabolic steroids are an absolute no-no. People who take gym supplements should avoid these also. If you're taking steroids for medical reasons, that's a different thing altogether, and they need to be continued as normal. So in terms of what causes male fertility problems, it's possible lifestyle issues can have a role, but in more profound problems there could be a genetic reason, and the clinic may wish to perform tests on you to exclude that particular possibility. So in terms of the run-up to treatment, there are some things that you need to be aware of. Many of the commissioning groups or funding bodies will only fund NHS treatment for women whose body mass index, that's the relationship between their height and their weight, is less than 30. So if you think you might not fall into this category whilst waiting to be seen by your fertility clinic, it's important to bear in mind that weight loss would be a useful strategy. Similar guidelines apply to cigarette smoking, so if you're a cigarette smoker, now is a good time to stop. The general guidance is that women who are planning to conceive should be taking a vitamin D and folic acid supplement, or at least discuss that with their doctor, and they should be up to date with their cervical smears. If you think there's something intrinsically wrong with your fertility, for example, you're not having regular periods, or you may have something for your medical history that could mean that your tubes have been blocked, obviously that's something that might need more specialist assessment. In terms of the male side of things, when you do get to clinic, you'll probably wish to be seen by someone who's going to examine you to work out what the situation is and to try and work out what treatments would be required. If you wish to take a vitamin supplement, something to improve your fertility, it'll probably do no harm if you take it as recommended, but the evidence that it makes a big difference is perhaps limited. But regular exercise is certainly a good measure to consider. So I hope you found that useful. If you want to find out more about fertility problems, please look up the website http://all-about-fertility.com, which provides excellent advice on all aspects of fertility, and also has a unique peer support platform so men who are affected by fertility challenges can log on anonymously and network with other men around the world for free to get support from each other. So I hope that you stay safe and look after each other, and we'll very much look forward to seeing you again in due course when all this is over. Thank you very much.